Jordan Estrada here. Today we're going to go over SpinaBifida. You can see if I can get this thing working. Okay. So the introduction basically, spina bifida is a birth defect. The defects happen when the neurotube does not close completely. This can result in physical and mental disabilities. There can be any range of mild to severe symptoms depending on the severity of the condition. Too far. Information on the disability. There's a hole or a gap in the neurotube. It occurs in the first trimester when the brain and spinal cord are forming. It often is called a snowflake condition because every case is unique. SpinaBifida, has causes that are both environmental and genetic. Names come from how the spine is bifided, which is a Latin term meaning split in two. Hope I said that right. The hole that I've referred to can be anywhere along the spine. The hole can cause damage to nerves and spinal cord. Definitely going to mess these up. So the first picture here, is your most severe type. The nerves leak into the hole. Your middle picture here is the nerves inside. There's a hole in the cord, as you see. And then the final picture all the way to the right is what you would call the least severe type anyways. So there's no gap, or there's a gap but no hole in the cord. Sorry. And the next one. So here we're going to look at how the disability occurs. There are several reasons here, but not one is clear. Your most common is folate defect, which is vitamin B or folic acid, which is needed for the baby's development. There can be, a family history of neural tubes defects, obesity, of course. Some anti-seizure medications have been linked to it. Diabetes. There's also a higher chance if the parent has spina bifida as well. Okay, some things you can do to prevent it, or not prevent it, but help at least. Which these are, of course, like I said, they're not like guaranteed, but they help. Women should take the recommended amount of folic acid, which from my research, what I found, it's 400 micrograms. You take before and during pregnancy. Control diabetes and obesity. These are choices, of course, that we can make to either help them or get us in better positioning. So you can either, of course, lose weight, be a little better off, or watch your diet and your sugars intakes and stuff. Manage your seizure medication. Talk to your doctor. Be aware of the risks you're taking of the medication, not as much or whatnot, and find a balance in between. Of course, you got signs, you'll have symptoms as well. Again, I'm bad with these words. So this is hydrocephalus, I think. I'm probably wrong. Water on the brain, basically. Where there's an excess amount of water or cerebral spinal fluid around the brain. That can cause a lot of other things too. Anyway, scoliosis, spinal formation problems. You got your bladder and bowel problems, UTIs, urinary tract infections, paralyzed limbs. They can range from, just partially or completely fully paralyzed. Back, leg, and feet problems. Skin sensitivity or even desensitivity because of your nerve issues there. And then, of course, like allergies. Latex. Sorry. So, we're at the diagnose point. Spina bifida is typically diagnosed before birth. There is an FAP, or shoot, I just said it all backwards. Sorry, AFP test, which is an alpha fetoprotein, which the babies produce. So this can be done from, of course, a blood sample, which is probably the most common, easy one, or an anomic. Boy, I tell you, I'm really bad with these. Amniotic fluid sample in the womb. Ultrasounds can sometimes detect them. If not diagnosed before birth, you can be diagnosed after birth with an X-ray, MRI, or CT scan. Okay. Here we got some basically pros we have. Prognosis. These are currently no cure for this right now. Like nothing that's going to take it away from you and be good. Of course, therapy helps. It can be either mental or physical types. They all help with managing it. Of course, a huge concern for this would long term is independence, but what you really you work on is of course your strength, accessibility, and mobility are some of your main components you want to look for. You also got need help physically to be prepared for the future. Life skills, daily activities, occupation, physical therapy. Prescriptions here, you'll collaborate. Collaboration is really where you're going to come from with your whole teamwork for safety and improvement in all areas, of course. Families, individuals with spina bifida, therapists, doctors, etc. There's a lot of devices that'll help with this. So anything from like a walker, crutches, of course, wheelchair, braces, even those special shoes you get and you gotta get inserts for. Things that are basically help with those and have problems walking. Not only aches or issues or something like again they can't move certain limbs. So part of the physical education part, uh, along with collaboration and use of devices. Each case is different with SB or spina bifida. Avoid certain activities, of course. There's certain things that are just kind of outside their realm that they're just not going to be capable of really participating with the general education room. You want to try to avoid those as best you can. uh, Something that's definitely going to be a bother for you is you're going to have to watch out for certain injuries, especially to the neck and head area. Any concern for displacing, interrupting, uh, like a shunt, anything like that, is really what you're going to be looking to avoid as well. You don't want the kid, playing dodgeball, get hit and, you know, doing some extra damage to them or something that they just can't really, it's hard for them to defend for themselves, we try to avoid those. I mean, of course, there's going to be certain games you're going to be able to modify and adapt for them to play, but those are the things you need to be concerned about and watching for at all times for sure, especially with these kids. Teachers and parents, they're going to have to give extra time, of course, and space allowed for even something as easy as going to the bathroom. Like, you're going to have to have a handicap bathroom for these kids to be able to get to if they got a wheelchair, access. It's going to take a little longer than normal, things like that. Also, you want to avoid, of course, latex materials with them. So, certain balls or equipment, you're going to have to make sure it's not, so that it's necessary for the kid to be able to actually able to use them. This here is just everyday support stuff. So, like immediate family, the neurologist, the therapist. And here I also have an organization here, the Spina Bifida Association. So here towards the end, there's still work to be done, of course. I mean, there's all kinds of studies constantly be done with spina bifida. Obviously, communication is definitely key. Don't be scared when working with them. Might be something outside your normal networking or your normal daily routine with people, but don't worry about it. Keep pushing. Take care of the main needs and concerns of them, and just watch out for them and adapt and modify, and you'll make everything work without being condescending or judgmental. All you really got to do is just ask for help and or research it, try to find a way, and they may or may not accept you, but you'll get through it and you'll make it work and be best for the kid. You can also let them be as independent as they wish. You just got just remember those with spina bifida are just like you, just they have different needs and their bodies could be a little bit changed compared to you, but there's not much of a difference as far as person wise. Alrighty, that's all I got for today. Thank you. And give me an A.